Let's talking about herpes viruses today. Herpes viridae is a large family of DNA viruses that cause infections and certain diseases in animals, including humans. The members of this family are also known as herpes viruses. The family name is derived from the Greek word herpine, referring to spreading cutaneous lesions, usually involving blisters, seen in flares of herpes simplex 1, herpes simplex 2, and herpes zoster, shingles. All members of the herpes viridae share a common structure, a relatively large, double-stranded, linear DNA genome encoding 100 to 200 genes encased within an icosahedral protein cage called the capsid, which is itself wrapped in a protein layer called the tegument containing both viral proteins and a lipid bilayer membrane called the envelope. Varicella zoster virus. Varicella, chickenpox, is the primary disease. Zoster, shingles, is the recurrent form. Chickenpox, also known as varicella, is a highly contagious disease caused by the initial infection with varicella zoster virus, VZV. The disease results in a characteristic skin rash that forms small, itchy blisters, which eventually scab over. It usually starts on the chest, back, and face. It then spreads to the rest of the body. Other symptoms may include fever, tiredness, and headaches. Symptoms usually last 5 to 7 days. Complications may occasionally include pneumonia, encephalitis, and bacterial skin infections. The disease is often more severe in adults than in children. Symptoms begin 10 to 21 days after exposure to the virus. Chickenpox is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of an infected person. It may be spread from 1 to 2 days before the rash appears until all lesions have crusted over. It may also spread through contact with the blisters. Those with shingles may spread chickenpox to those who are not immune through contact with the blisters. The disease can usually be diagnosed based on the presenting symptom, however, in unusual cases it may be confirmed by polymerase chain reaction, PCR, testing of the blister fluid or scabs. Testing for antibodies may be done to determine if a person is immune. People usually only get chickenpox once. Although reinfections by the virus occur, these reinfections usually do not cause any symptoms. Signs and symptoms. A single blister, typical during the early stages of the rash. The early symptoms in adolescents and adults are nausea, loss of appetite, aching muscles, and headache. This is followed by the characteristic rash or oral sores, malaise, and a low-grade fever that signal the presence of the disease. In children, the illness is not usually preceded by prodromal symptoms, and the first sign is the rash or the spots in the oral cavity. The rash begins as small red dots on the face, scalp, upper arms, and legs, progressing over 10 to 12 hours to small bumps, blisters, and pustules, followed by umbilication and the formation of scabs. At the blister stage, intense itching is usually present. Blisters may also occur on the palms, soles, and genital area. Commonly, visible evidence of the disease develops in the oral cavity and tonsil areas in the form of small ulcers which can be painful or itchy or both. These symptoms of chickenpox appear 10 to 21 days after exposure to a contagious person. Adults may have a more widespread rash and longer fever, and they are more likely to experience complications, such as varicella pneumonia. Because watery nasal discharge containing live virus usually precedes both exanthem, external rash, and enanthem, oral ulcers, by 1 to 2 days, the infected person actually becomes contagious 1 to 2 days before recognition of the disease. Contagiousness persists until all vesicular lesions have become dry crusts, scabs, which usually entails 4 or 5 days, by which time nasal shedding of live virus ceases. The condition usually resolves by itself within a week or 2. The rash may, however, last for up to 1 month. Chickenpox is rarely fatal, although it is generally more severe in adult men than in women or children. Non-immune pregnant women and those with a suppressed immune system are at highest risk of serious complications. Diagnosis: chickenpox. The diagnosis of chickenpox is primarily based on the signs and symptoms, with typical early symptoms followed by a characteristic rash. Confirmation of the diagnosis is by examination of the fluid within the vesicles of the rash, or by testing blood for evidence of an acute immunologic response. Vesicular fluid can be examined with a zinc smear, or by testing for direct fluorescent antibody. The fluid can also be cultured, whereby attempts are made to grow the virus from a fluid sample. Blood tests can be used to identify a response to acute infection, IgM, or previous infection and subsequent immunity, IgG. Prevention. Hygiene measures. The spread of chickenpox can be prevented by isolating affected individuals. Contagion is by exposure to respiratory droplets, or direct contact with lesions, within a period lasting from 3 days before the onset of the rash, to 4 days after the onset of the rash. Vaccine. The varicella vaccine is recommended in many countries. Some countries require the varicella vaccination or an exemption before entering elementary school. A second dose is recommended 5 years after the initial immunization. A vaccinated person is likely to have a milder case of chickenpox if they become infected. Immunization within 3 days following household contact reduces infection rates and severity in children. Treatment. Treatment mainly consists of easing the symptoms. As a protective measure, people are usually required to stay at home while they are infectious to avoid spreading the disease to others. Cutting the nails short or wearing gloves may prevent scratching and minimize the risk of secondary infections. Shingles. After a chickenpox infection, the virus remains dormant in the body's nerve tissues. The immune system keeps the virus at bay, but later in life, usually in an adult, it can be reactivated and cause a different form of the viral infection called shingles, also known as herpes zoster. Shingles affects 1 in 5 adults infected with chickenpox as children, especially those who are immune suppressed, particularly from cancer, HIV, or other conditions. Stress can bring on shingles as well, although scientists are still researching the connection. Shingles is most commonly found in adults over the age of 60 who were diagnosed with chickenpox when they were under the age of 1. The signs and symptoms of shingles usually affect only a small section of one side of your body. These signs and symptoms may include pain, burning, numbness, or tingling, sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, itching. Some people also experience fever, headache, sensitivity to light, fatigue. Pain is usually the first symptom of shingles. For some, it can be intense. Depending on the location of the pain, it can sometimes be mistaken for a symptom of problems affecting the heart, lungs, or kidneys. Some people experience shingles pain without ever developing the rash. Most commonly, the shingles rash develops as a stripe of blisters that wraps around either the left or right side of your torso. Sometimes the shingles rash occurs around one eye or on one side of the neck or face. Treatment. Treatment mainly consists of easing the symptoms. Antivirals are sometimes used. Acupuncture could help to relieve pain. Thanks for watching. If you like this video, please thumb up and leave a message. You must be my biggest motivation to make the video. Please subscribe to the channel, where you'll find more and more medical videos here later. Thanks.